This is Mrs. Burns. She recently had a fall and doesn't feel confident on her feet, so needs assistance with walking. It's lunchtime, so the carer helps her to walk to the table. While standing, Mrs. Burns feels her legs are going to give way, so she sits back down. Is she wearing the appropriate footwear? Is she using the walking aid in the correct way? Is it her walking aid? What do her feet look like? Swollen? Sore? Does she usually wear glasses? If so, is she wearing them now? What is the environment like? Cluttered? Poor lighting? Trip hazards? Any pre-existing conditions that you know of, for example, low blood pressure? Mrs. Burns is a bit wobbly and doesn't feel very safe. Her slippers are pinching and she hasn't had anything to eat or drink today. She said the other carer keeps putting her drinks out of reach and explains that she didn't eat her breakfast as she dozed off. The carer looks in the Stop Look Care book to see what it says about the things Mrs. Burns is describing. The carer thinks Mrs. Burns might not be eating enough. Her feet look swollen too, so she's going to do the following. Make sure she is safe and in an environment that is uncluttered. Place a drink within her reach. The carer will also monitor and document what she has had to eat and drink. Check the care plan to see if Mrs. Burns is diagnosed with diabetes. Speak with her son about a different pair of slippers. Escalate the symptoms to the community falls team and/or the GP. Reporting your concerns using SBARD. Situation. Here, make sure you have confirmed your name and the person you are calling about and why you are calling, contacting. Background. Here, state the patient's normal condition and how it's changed, their relevant history and current medications. Assessment. Here, state your findings, what you think the problem may be and what your concerns are. Recommendation. Here, state whether you need assistance, need somebody to visit or need advice. Decision. Here, state the decision of the person you escalated to. Using Stop Look Care can help you identify deteriorating health at an early stage and understand what actions to take. Stop, Look, Care, supporting you to deliver great care.